Veronica, I'm here with my patient, Mr. Danny. He is 55 years old, an engineer. He presented today at the outpatient department with a complaint of ear pain, sore throat, increasing shortness of breath, and limited range of motion in the upper extremities. I'm going to begin this procedure by washing my hands. I'll put on my gloves, clean my stethoscope with alcohol swab, and I'm moving in to introduce myself to the patient and to seek consent. Hi, my name is Veronica, and I will be your nurse today. How are you? I'm going to be examining you from head to toe in order to establish the general state of your head. It's going to take about 10 minutes. Is it okay? You want to use the washroom before we get started? No. I'm going to provide you with privacy, cover you with this blanket, and I'll ask you to state your last name and your date of birth. Thank you. Beginning with your ear is symmetrical on both sides. The left ear is the same like the right ear, and I don't see any discharges or any cerumen build up in your ear. I'm going to palpate the auricles and the trigals for any tenderness or pain. Do you feel pains? Yes, that is related to the ear pain. I'm going to test for any hearing impairment using the whispering test. I'll ask you to block your left ear, and I'm going to whisper in your right ear. 4, 5, 6. What did I say? 4, 5, 6. And I'm going to ask you to block your right ear, and I'm going to whisper in your left ear. What did I say? 4SA. That shows that the patient does not have any hearing deficit. I'm going to examine your nose. They appear to be on the midline, and the color is consistent with the rest of the body. There's nasal flaring, no crusting, and no septal deviation. I'm going to palpate the frontal sinuses and the maxillary sinuses for any sign of acute sinusitis. Do you feel pains? No. It means that the patient does not have any sign of acute sinusitis. I'm going to examine your mouth. The lips appear pink and well hydrated. Can you open your mouth? Your gums appear pink and no bleeding. Can I see your teeth? They appear white and no sign of dental caries. Can I see your tongue? I'm going to use the tongue depressor to examine the base of the tongue. Their tongue is on the midline, no sign of tongue atrophy, and no abnormal lateral movement of the tongue. I'm going to examine the hard palate. It appears pink and no visible lesions. I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 10, which is the vagus nerve. Can you say ah? When the patient says ah, I notice the rise of the soft palate and the uvula, which means that the two nerves are functional. I'm going to test for cranial nerve number 12, which is hypoglossal nerve. I'll ask the patient to stick the tongue out and roll it from side to side and say light, tight, dynamite. No tremors, which means that that nerve is functional. Next, I'm going to examine your neck. Your head is well seated on the neck. The color is consistent with the rest of the body. No visible masses, no scars, and the trachea appears to be on the midline below the larynx, and there is enlargement of the thyroid gland. I'm going to palpate for any temperature or tenderness. There's none. And I'm going to palpate the carotid artery on both sides for 30 seconds each. And the carotid pulse is 62 beats per minute, and the strength is 2+. It's regular, which is a normal assessment of the carotid pulse. Next, I'm going to test for the spinal accessory nerve, which is cranial nerve number 11. I'll ask the patient. I'm going to place my hand on the right side on his right neck, and I'll ask him to tilt his neck to the right against the resistance of my hand. And I'm going to do same on the left side, and I'm going to ask the patient to tilt his head to the left side against the resistance of my hand, and I'll ask him to shrug his fingers against the resistance. The patient did this without any stiffness or experiencing pain, which means that the spinal accessory nerve is functional. I'm going to examine the upper extremities, beginning with the hands. the hands, the hair is evenly distributed, no scars, no sign of diaphoresis, no edema or swelling, and I don't see the symmetry of the hand. The right hand is equal to is the same like the left hand. I'm going to palpate for any joint temperature or tenderness. I'm going to feel for muscle bulk, sugar of the skin, and to feel for the temperature. All these values are normal. The assessment is normal. There's no abnormality. I'm going to check the nails. It appears pink and the capillary refill is less than 3 seconds. I'm going to ask you to flex your fingers, extend your fingers, to invasion and evasion of the finger. Good. And I'm going to ask you to flex the wrist and extend the wrist. Good. And I'm going to ask you to flex the elbow and extend the elbow. Good. And I'm also going to ask you to do pronation and to do supination and pronation of the elbow. Great. I'm going to ask you to shrug your shoulder, do adduction and abduction, and internal and external rotation of the hand. The patient felt some pains doing adduction, shrugging the shoulders, and doing adduction and abduction of the hand. He also experienced pains in the course of doing the internal and rotation of the hand. That shows that he has limited range of motion in the upper extremity. I'm going to examine the thorax, and I'm going to ask you, Mr. Dan, can you take off your shirt so that I can be able to better assess your chest, beginning from the back? Thank you. So in the examination of the chest, the back appears to be straight, the spine is on the midline, and the symmetry of the left back and the right back. There's no visible scars, and the contour, talking about the contour, I don't see any sign of kyphosis, scoliosis, or any barrel shape of the chest. And the transverse ratio, that is the ratio from side to side, is 2, and the anterior posterior ratio, that is from front to back, is 1. That gives us a ratio of the anterior posterior transverse ratio of 2:1, which is a normal assessment. I'm going to test for tactile fremitus. When I place the heels of my palm on the shoulders on your back, please say 99, 99, 99, 99. The vibration I felt when neither too high nor too weak. So that shows that the heart has a normal density. And next, I'm going to check for the symmetrical expansion of the chest. I'm going to grab some adipose tissue around below the rib cage, and I'll ask the patient to breathe in. On breathing in, the chest, there's a gap that is created between my fingers, and when he breathes out, my fingers are back to the previous position. That shows that there's normal expansion of the chest wall. Next, I'm going to use my I'm going to palpate the back for any tenderness, any pain, any lesions, and feel for the temperature of the back, and also to feel for the hydration of the back. All this appears to be normal. I'm also going to use my stethoscope to feel for the heart, the lung sounds, the normal sounds, the vesicular and the bronchovesicular sounds. The vesicular sounds are usually felt on the back of the patient, on the outer part, on the periphery, and on the midline. I'm going to feel for the bronchovesicular sounds. I'm going to place the stethoscope for 1 full minute to listen for the sound, and I'm beginning from the outside or the outer part, and then the middle part, and then next out, and then middle, from top to bottom. The vesicular sound appears a low pitch sound that I heard, and for the bronchovesicular sound, I heard wheezing sound, and these wheezing sounds are usually described as adventitious sounds, which are abnormal sounds of the heart, and that can explain why the patient is having shortness of breath. I'm going to examine your anterior thorax. Can you please turn? Thank you. And I noticed that respiration is very rapid at 26 beats breath per minute, and for the rhythm, it's unregular, and inspiration is greater than expiration, and there's some evidence of use of the accessory muscles. That is evidenced by the contraction of the sternocleidomastoid muscles and the trapezius muscles. Okay, that ends my examination today, and I wish you a speedy recovery. Bye.